What's going on, you guys? Hey, thanks for watching this video. In this video, I want to talk about hospital culture. So this one's going to be pretty quick here because I am almost to the hospital. But I was talking with my friend the other day and she was, kind of having a tough time. She's a surgeon and a woman. And often girls have to be, or feel like, they don't have to be, but they feel, women surgeons feel like they have to be over aggressive to like establish their knowledge and their authority and stuff like that. Unfortunately, I understand why some do that, and I think she got into a little bit of a pickle because of that. And she's really good and she's actually super nice, but I think sometimes she gets sucked into the world of the hospital and being more aggressive than normally she is. And it's a little bit of both. I think it's she is trying to establish herself as an authority figure in her group of surgeons, the medical students, the residents, and all that stuff. In most hospitals, and that I've seen, we developed this culture of like the doctors having to establish this authority over everybody else, and even between each other. And the residents especially, they'll kind of like be aggressive, right? You see residents and doctors being aggressive to like nurses and students, especially students or scrub techs. And unfortunately, it's like a culture of medicine. And I just wanted to take a little time to talk about that and make you aware of it. I know you probably are, but I guess what I wanted to say is to be aware that you don't have to do that. And it's hard because I do it too, honestly. I'm guilty of it for sure, but we're trained like that. So through training of 6 years, like I was trained by my mentors. Like I watched those people, what they did, that's what they did. I tried to emulate them. Like that's just what you do. It's not like you're cognitively doing that, but that's what you do. You emulate your mentors. And so you end up with this kind of aggressive stance. Although it's a difficult situation, right? You want to make sure that things happen that you think should happen for the patient. And we all see things differently as a scrub tech, as a nurse, as a doctor, or a surgeon, as an anesthesiologist. We all see the patient a little bit differently. And we want the things that we think are important to happen. And we can get sucked into that aggressive stance, but just know that you don't have to do that. And try and, when you catch yourself doing that, try not to do that as much, because you catch more bees with honey. And if you're nice to people, take the time out to educate them, not in a condescending way, then they'll appreciate you a lot more. We don't always have time to do that, and I think that when you have a time crunch, if you put somebody under a time crunch, then that aggressiveness certainly comes out as well. And that's maybe why, or probably one reason why our hospitals end up with this aggressive kind of culture. But a lot of people that I work with now are not like that at all, and I'm like, I'm a dick. I really try and focus on not doing that. And the reason I'm bringing this up is because I talked to my friend the other day, and then overnight I got called and I was kind of a jerk, and I was like, God, I just default to that. We really have to, collectively, we have to really concentrate on not doing that. It's just a lot better for everybody involved if you can just teach whoever's on the other end of a phone call, like in this case, instead of being a jerk. I don't know if that helps at all, but that's just something on my mind this morning. I was coming to work. So anyway, you guys, hey, thanks for watching these videos. Subscribe, like, share, put some comments in below, and that'll be awesome. And I'll see you in the next one. Take care.